Michael Rimgard from Tanzania, East Africa, and I'm 42 years old now. I've come here to search for the medical treatment, especially which is liver transplant. Which is liver problems, liver cirrhosis. I've been here since September last year, 2023. Till now, everything goes well. Yeah, Mr. Saif Mkwawa is my relative from Tanzania. We are all coming from the same region. He came here, he volunteers himself to be a first donor. No, nothing has been given, nothing has been promised to him, but he is willing from his heart to rescue my life by giving the liver. But unfortunately, as I discussed, that the situation was not well, was discovered that there is a mark, so he could not support me. Due to the mark determined to his liver, discovered to his liver, we could not contribute. But he is saying thanks to the doctors and all management and the staff of the Fortis for the support he received. He donated the blood for my treatment. So he's happy, he's now very okay. He said that we are preparing to go back to Tanzania, and very soon we will be back to Tanzania. We are coming as a new people, as well-treated peoples, and we are proud of the place where we have been.
So Mr. John, he came from Tanzania, and when he came to us, he was very sick. He had chronic liver disease with decompensated with ascites. He had jaundice. He had hepatorenal syndrome. He had an episode of hepatic encephalopathy, and also he had a recent bleed for which endoscopy was done. But his weight was 116 kgs and his BMI was 45. He had obstructive sleep apnea. For that, he was on CPAP. So overall, his condition was not very good, and he required an early transplant. So his niece came forward as a prospective donor. We evaluated her according to protocol, and she was found to be fit.
Main challenge in this transplant was the weight of the recipient, and of course his multiple comorbidities. The donor whom we evaluated weighed around 60 kilos and her liver weight was only 600 grams. So using that liver for a 116 kg recipient was a technical challenge. So we did careful planning preoperatively, studied the CT scan, and we decided to change our technique a little bit. We also did a splenectomy in the recipient to modulate the portal flow. Surprisingly, had a relatively smooth course post-operatively, and he was discharged in about 2 weeks. More importantly, I would say that this was a leap of faith by the patient and the relatives, and they placed their complete trust in us because it was a high-risk transplant. We are really happy that John and his family really trusted us, and we are actually humbled by the fact that we could help them and send them home safely.
As she introduced, her name is Susan Francis. She's from Tanzania. She's my nephew, and she came here for donation for the liver, and I'm the patient who receiving the liver from her. As she said that she's now good, she's continuing well. She thanks doctors and all other management of Fortis Hospital. Thanks a lot.
CureSureMedico has helped patients around the globe receive the best liver transplant treatments at an affordable cost.